we'll start here.
We don't know which one we are.
What do you mean?
We don't know which one we are. We haven't done a podcast. I mean, you did that one. But.
All right, that's fine. Okay, hey, welcome to our latest podcast. I'm Dr. Joshua Fink, Dr. Matt Fink.
Dr. Matthew Fink, thank you.
We had some great topics that we were going to cover today. Teach you guys how to live healthy forever, teach you guys how to make a bunch of money and be happy. But we're not going to talk about any of that. Instead, we're going to waste our time once again talking about chiropractic and stroke, because seems like every 10 or 15 years, some medical doctor or some other person forgets what they've learned and decides that chiropractors cause stroke. And they go on the news and they write these papers and they publish this stuff. And all of the things, they just based on this BS data. You know, the thing is that if you go into a chiropractic office and you have a stroke, in their mind that we caused that stroke, or the chiropractic adjustment caused that stroke. And it's just not true. There's none. There's no evidence, no experimental evidence that's ever been done that proves that chiropractic adjustments cause stroke. Zero. Now, are there anecdotal things where people say, oh, I was at the chiropractic office and they adjusted me and I had a stroke? I'm sure there are, you guys. People come in here with headaches because that's one of the hallmarks of stroke, you know, neck pain and what we've come to, you know, the headache that you feel like you've never had before. You know, so do people have strokes in our office? Sure, you know. That's because they were having the stroke when they came in. News Channel 5 did this thing the other week where they interviewed a guy who got adjusted on a Friday, and then the following Wednesday he had a stroke. And the gist of the article is that the chiropractic doctor caused the stroke. I mean, that's 5 days later. I mean, the other things that cause this particular type of stroke, you guys, are people looking over when you look over your shoulder, like if somebody calls your name, if you're driving in traffic, if you're leaning your head back over a sink, all of those are known causes of this. And they're trying to tell you that even though that guy did all those other stuff between then and that we're the cause of that. It's just, I mean, it's almost too unbelievable to believe that a major news source would hang themselves out like that and look that ridiculous, but they did.
And somehow they got away with airing it.
Yeah.
And then all of our patients in the last 2 weeks have been talking about, well, did you guys, they've actually come in laughing.
Yeah.
Because they know better.
Yeah.
Because we've taught them, hey, this wasn't caused by the chiropractic adjustment. Now, as chiropractors, it's our job to notice those symptoms and refer them out immediately. So there's a reason why our malpractice insurance is like $1,500 a year. It's because we're very good diagnosticians and we pay attention to what our patients are. You know, so we see our patients a lot, and we always have a beeline, and we always have a hardwire into how they're feeling and what they're doing and what's going on in life. So, but yeah, there's no reason that they should be airing that kind of stuff. And it's, you know, that's the kind of stuff that, you know, DCs and MDs, and why there's such a, you know, hidden animosity between them.
There really is. There really is.
We had a patient come in today and talked about everybody should be a team player, and that is a big deal. And when something gets aired that says, hey, you know, don't go to a chiropractor, they'll stroke you out, that's ridiculous. And, you know, this is Dr. Josh's and I's and Dr. Mauer's. This is our livelihood. This is what we do for a living. We could not make people better. We cannot make the money that we've made if we stroke people out all day long. There'd be nobody left to adjust.
And even if one, how many adjustments have we done?
2,400, 24,000, 2,400.
Well, no, it's like 250, 275 for 15 years.
Oh yeah.
It's almost $250,000.
No.
Now, and we do our adjusting right here out in the open. Have we ever had a stroke? No. Now, you go to any hospital and you say, well, let's look at your last $250,000 procedures. Let's see what happened. Forget it. You know? I mean, it's just ridiculous to even think that. Nobody has had no one, ever. And we do our adjusting out in the open. And like Dr. Matt said, our malpractice insurance is $1,500 a year. You know, malpractice insurance companies, they don't care whether or not you're trying to get people healthy. They don't care about the bigger picture. They don't care about anything other than who are the doctors who are high risk and who aren't. We pay, Maddie said, $1,500 a year. You know, general practitioners are going to pay 10 times that. That'll tell you right there who the risky doctors are. So hopefully you guys are crystal clear. We won't have to waste our time anymore with this podcast. Now we've got it digitally. We'll save it on the internet. You can distribute it to whoever you want. There's absolutely no evidence. There never has been. People don't know the difference between causality and temporality. They don't understand those definitions, and they don't bother learning. So hopefully we won't have to waste our time on this anymore. Also on the website is a specific podcast that I sent to Mike Bush, who was the reporter on that article last week, and I'm just pretty much telling him exactly what's what. So if you want to watch that as well, it's a pretty good article. So what's our, don't we have like a secret phrase?
I think 2-to-1 stroke ratio.
All right. No, that's fine. You're the namer of the thing. You're the namer of the thing.
More like a weed whacker than oil to gas, but I don't know.
You just want to make it weed whacker?
Yeah, weed whacker. That's great.
Weed whacker is the secret phrase. Tell it to Peggy. We've given out like 4 massages, so it's like the same 3 people watching this thing, so they take turns winning the massage. So anyway, if you get a chance to see it, come in and say weed whacker to Peggy. And if you have any other questions regarding this topic, please ask us. We want you guys to be educated. We want you to know why you're here, why we're taking good care of you like this. It shouldn't be how it is, where we got a guy telling you one thing and us telling you the exact opposite. That's not healthcare. That's not responsible. So anyway, if you have questions or something, ask us. And if you want us to call your MD and set them straight, I'm perfectly happy to do that. So, all right, you have anything that you want to?
No, I mean, that's pretty much it. That's pretty much it. Welcome back to the podcast, by the way.
Welcome back. All right, we'll talk to you guys later. Thank you. Good job, Matt. That was a nice wave. How do you pause it? Okay.